Hi, good morning. So it's a beautiful Sunday morning, and I'm sitting here with Dr. Sharon. Let's ask her a few questions about our eyes.
Hi everyone, happy to be here to have this fun chat with Shveka.
So, tell me, Dr. Sharon, how often should people go and get their eyes checked? I mean, even if they don't feel anything.
It's a great question. First thing, even if you don't feel any problem with your eye, it's recommended to have a regular checkup. The reason being that there are certain conditions like diabetic retinopathy, glaucoma, or even early cataracts that you may not even realize that you have a problem in the early stages. And as they say, prevention is better than cure, so the earlier you pick it up, the better you can control or manage these conditions. So it makes sense to go for a regular checkup.
Wow, beautiful. Though I didn't understand some of the words there, but that's okay. If you're watching us, please go get your eyes checked. If you're in Bangalore, please get it checked from her. So, even children, how early should a child for the first time get their eyes checked?
Yes, so with children it's all the more important because obviously very small children can't express their eye problems or understand even if they're having an eye problem. So probably it's a good idea, the earlier the better. We do have ways to check even vision or their eyes, the retina, everything, even in babies. So the earlier the better. And if you see anything like a white reflex in the eye, or when you shine the torch, normally you see a red light in the pupil, but if you see something white, then that's an emergency to go and get the eye checked. So earlier the better, even with children.
Okay, but when you say earlier, like, would it be like maybe 2 years, 1 year? How early would you recommend that the first time a parent thinks about it and goes out and?
Yeah, so around by 3, it's a good age where they will be able to at least recognize some pictures. So we will get a very good assessment of their vision. So preschool or early schooling time would be a good idea to do a first check if there's no other problem.
And similarly for adults, would you say that, is there a periodic time where people should go get it checked?
So ideally every year a yearly checkup is recommended, even if you don't have a problem. But yes, if you're really very busy, maybe once in 2 years. But after the age of say 40, 45, everyone does develop some amount of reading power, or they may have other problems which they're predisposed to. So a yearly checkup makes sense even if you don't have a problem.
Okay, great. Coming to spectacles, since I wear spectacles a lot, I mean, there are a lot of, I don't know, it could be a myth or what, let's clear it out today. People say that wearing glasses a lot makes you very dependent, and does that harm the eyes in any way?
That's a very, very interesting question, and it is definitely a myth where people say if you keep wearing the glasses, your eyes are getting weaker, or if you don't wear the glasses also, your eyes are getting weaker, both sides, depending on where you're hearing the myth from. Let's put it this way: if you have broken your leg, you need a crutch for some time. If you have a glass power, you're going to need to wear the glasses to have your vision as clear as possible.
Right.
It doesn't make your eyes more dependent, and it doesn't mean that if you wear the glasses, your eye will get weaker and weaker because it's getting more and more dependent and your power will rise.
Right.
The reason your glass power changes is because of certain changes in the shape or the size of the eye, and that usually happens during the growing period and would stop for most people by 2021. So definitely your eyes don't become dependent on the glasses, but it actually helps your eyes avoid any eye strain if you do have a power to wear the glasses regularly.
Is there a way where people who don't have a power, is there a way that they could avoid having a power or something?
Not really. In children and in adults, this answer would vary. So in adults, it doesn't change anything. There is no exercise or work or food which prevents you from developing refractive error or power, glass power. So it's just a physiological change, it's just a change in the body which happens over time. In children, this idea has changed a lot. There's a lot of research now which tells us that for children who do very prolonged near work, be it very close reading or even the mobiles now, they do have a tendency for developing, for their power to keep increasing. We call it progressive myopia. So it's encouraged for children to do a lot of outdoor activities, play more, play in the sun, have vitamin D exposure to reduce their chance of developing or increasing their power very fast. So that's a change in understanding that we do have now.
Right. Dr. Sharon, I'm sure everybody who's listening us, they have a question. we've been told carrots. If you eat a lot of carrot, you don't get power, or if you eat a lot of carrot, it gets better. The eyes get better. There's also some exercises I've heard where if you focus on one point on the wall, it gets better. Do these things actually work?
Carrots, I think, other than helping the carrot sellers, wouldn't be that beneficial. But yes, what you're right about is that carrots have vitamin A, so they are very good for the development of the retina. So in very small children, it's good to have a balanced diet because that helps their retina develop. Carrots doesn't have any role, and it definitely doesn't have any role at any age to change the power, glass power that a person has. As for the exercises, now this actually was, I think even recently there were a lot of videos going around about exercises and doing this, and people do claim to have results where their power has gone off or reduced, but actually that's not true, at least to my knowledge, where these exercises don't help change the power in any way, reduce or prevent it from increasing. Where some exercises are useful is that some people have certain weaknesses of their eye muscles where they can't focus that well, and these exercises, we give them certain exercises. It's like doing physiotherapy for the eye muscles to focus better, but that's a totally different set of issues. It's nothing to do with your glass power as such. So.
Okay, coming to phones and screen scrolling, how bad is that for the eyes?
So I'm sure the answer I give you is not going to be very popular. Or
but I mean, because these days there's so much mindless scrolling happening. We don't realize how long and how long in one time we're on the phone. So I think this is something people really would want to know about.
It's true. So again, the thing with phones or any digital device, there are a few factors that are important. One is the size of the device. So the smaller the device, like mobile phones, are probably causing more of strain on your eyes than someone who is watching TV. Also the distance. So if you're holding it fairly close, that's likely to cause you more strain than if you're watching on a bigger screen at a distance. So that is something that we need to remember. Scrolling for hours definitely increases the strain on the eye. Again, it's not that your glass power would change due to that, but then it can cause a lot of eye strain. It can cause a lot of headache, dryness of the eyes. So definitely not advisable, and do it in breaks if you have to.
So what does one do in the break? Should we go wash our eyes, or take a break, look outside the window at the trees? Does that help the eyes?
Yes. So one thing which I'm sure is quite popular or known to people is something called the 20-20-20 rule. Okay. Which classically is described as every 20 minutes you take a break for 20 seconds and look 20 feet away. Okay. Now most of those things are difficult because every 20 minutes when we are working, and I know, for anyone who's engrossed in your work, you can't take a break every 20 minutes. So let's modify that a little bit. So every 2-3 hours you take a break. Now when we say take a break, I don't mean you get up, go for your coffee or whatever, because again it's difficult. What you actually have to do is look away from your screen or device into whatever is the longest distance that you can see. Okay. What happens again is when we are looking at a distance, our eye muscles are relaxed.
Right.
As we have to focus closer and closer, they are coming into play. Okay. So obviously the near vision is where they have the maximum amount of work to do. Blink a few times, so 10-15 times blink your eyes. That helps with spreading the tear film also, and then get back to work. So this itself would help significantly in reducing the strain on your eyes.
So 20 minutes of work, 20 seconds of looking 20 feet away. Look at somebody you really like and tell them to sit far away and look at them. So we're going to take a break, and we're going to blink our eyes in the break. You do the same, and we will get back to you with some more interesting questions and answers.